I'm recording and I'm muted again. I'll give up today. All right. Sorry, guys. I was muted there. Habit. Just muting myself. I'm so confused. All right. So what I was saying is this app bar is what I'm logging into right now. And what this app bar does is you'll set it up, and I'll show you how to set it up. And some of you may already know about it, but it gives you the abilities to put all of the icons or the areas that you're going to log into one area and sign in one time and not have to sign on every time that you click on open up an icon. So this bar will be floating and it'll be within the system. Like you can move it or you can make it stationary along the side. It's up to you. But we'll go in and I'll show you how to set this up. I don't want to log in myself. BHRN. Nope, AMBRN. Yeah. I'm going to log in as a provider right now just so that everybody can see it. So when I logged in, you can see it made this bar up here at the top. It's not floating. This is a stationary one. Maybe it's, yeah, like I can click and move it, but it's stationary and it goes the whole way across. Well, how to set it up is you will right click on the A and you can change it to always at the top, float, larger buttons, those kind of things. You can change it however you want, but where am I going here?
You want to right or click on it.
Click on it. Good. Change application, so you customize. So you will come down here to customize and you will go to buttons and you'll go down through here and find and put a check mark in the box of the ones that you want. So I will want power charts. I will want rev cycle and CDI. Not seeing it. Maybe this one may not, but there will be another in here that is called CDI that you will need. It's not listed there. And then you will just go ahead and click OK. You can move these around if you need to, but if you click OK, it'll put them here. So now you have this icon, which is this icon here, and this one. So when you click on these, you'll log into AppBar and it will log you in. So now when I click on this, it's going to automatically log me into PowerChart. Okay, so that is how you set up your AppBar. It does make these supposedly stay open longer than if you log in the normal way, which is like 20 minutes, and then you get those idle time pop-ups if you're not doing anything or whatever within the system. Does anybody have any questions on that? Okay, I gotta log out though because I don't know how to log out of it.
You can suspend it. Or
exit there. It's there now.
I always end up suspending it because I did not use that bar.
All right, so I am going to go ahead and log into PowerChart as a nurse now, just because we were working on the app bar this morning with the nurse. That's because of the access. And Dina, you should have it. Is that correct?
Yes.
And Sierra, you should have access to the power bar too, app bar?
Yes.
Okay. Let's just see it and give it to the patient one. And you guys can use this login to get into Mock and play around It's BHAMBRN and password is MOCK. It's underscore. This is the system, and I can send you a link to get in there as well. So you just get in and mess. When you log into PowerChart, this is what you're going to log into. This is what is considered to be your home. What is in GE we call our chart desktop, okay? Over here you have what is called your inbox, which in Cerner it is called your message center. So this is here is where any messages, phone notes, those kind of things, any labs that the provider sends you that the patient needs to be called, your cast that you have will be here. The providers will have the same thing in different things. Saved documents are documents that you started but did not finish. You just saved them. So if you do any power forms or things like that and you click the save button instead of the sign button, they will go here and sit until you go in and you sign them, okay? And paper-based documents, I don't know what that one is. Is that part of work queue management? No? Okay.
Yeah, kind of.
Yeah, kind of.
It's anything that's scanned or anything that comes from there, it's just a, you know what I mean?
Okay. And then you have your sent items and your trash items. So any items that you sent, they will be there. Proxies. The term proxy is a little bit different in what it is in GE compared to what it is in Cerner. So we have generic boxes, which is just a generic user account that we have created. Proxy, though, in Cerner is actually you going in and managing someone else's box. They have to give you permission to do it to be able to share each other's boxes. But these proxies are basically if I go out of town for a while and I need somebody to look over my box because providers still may send me things and I'm out of town, I can give another nurse access to get in and manage my box. I think, Erica, you may have the ability to go in and do it if somebody would forget to do it as well, I think is how they're setting it up to do it. But the user, the most thing is before they leave is to do it before they leave and send it to the staff member so they have access. You would just go ahead and you would click on manage. And when you do that, this will pull in. It's not completely set up, so it's very hard for me to find somebody. But I can go ahead and proxies given by me. So if I click add, I can come in here and search a user, and give them access to it. So if I put in IRC RN and I search no matches because it's not set up. Look, honey, multiple matches. So here's a high. So if I look here, I can see here's and I click OK. And I come down here and I grant access to my box and accept and next, or I can click OK and it will send them and tell them that they have access to your box. So that is how the proxies work, and it will give them access to everything that is in there. So that is one thing, and you can set the time frames on, when you want them to be in there, when you don't want them to be in there, different things. You can set dates, and you can revoke it at any time as well. So if I wanted to revoke, I just hit revoke all, and then I click OK because I never gave it. It was. Proxies taken from me, if I can see it when they were taken from me as well, access to different proxies. So that is how the proxies there work. And then I'm going to go out of here. I'm going to hit cancel. Then you have what is called polls. What polls are what we used to call our proxies. So you're going to have your front desk, and you're going to have your nursing proxies or polls, nursing polls, that where if a provider needs something done, they can send it to this generic account and everybody can get in and manage it. So that a lot of times those places are doing it specifically so it's not all on one person to take care of things if it's multiple people that can do it. So they'll send it to this generic one, and then whoever can take care of it gets in and takes care of it and can put their name beside it that they're addressing the message. And you can, it's the same way there that you can go ahead and manage, and you can search for your polls. So there should be, yours are going to be called behavior for Du Bois and Brookville. So you have your behavior front and nurse. So these have been built. And then for Bright Horizons, yours is Bright. And you'll be under Bright Horizons front and nurse. Okay. So you would just want to go ahead and add one of these up into it. So this is going to be a setting that you'll have to do when you get in, is you'll have to opt into being able to see that poll and then click OK. And it's saving that setting, so now you have access to see that poll. Might want to click OK. So now I can see as I'm in here, and as you save them, they do save in the drop down, so then you can just go in between them. You have your settings of the last 30 days that only see messages from the last 30 days. You can load all, you can change these criteria based upon. You can put filters in, signed and unsigned documents as well, and different filters. So you have those, but that is the difference between your message center and what all of this is. Over here, when you're on this home screen, you're gonna have your schedule. You're gonna have your schedule for today, and you can have it based upon provider. You can have it based upon your location. So if I put in here behavior, and it's just behavior, because we had to shorten some names, and I can click on where it has all of the people, click behavior, and it will give me that, the one with the group of people will give me everybody for that day. You can break it down. This is the Du Bois office, so you can break it down and see it a little bit different. This is your day view you guys are going to have, because it is a bigger practice. You are going to go ahead and it's going to be big when you look at the day view, okay? So if you want, you can break it down and just look at so many providers. You can change this as frequently as you need to. The best way I honestly say to look at it to me is it's the preference, because this is jumble, is the list view. So when you are on the list view, it's, let's see if I can go back to a day. We have a patient. Am I on Dr. Cook? I know we had patients on here. There. So when I am on the list view, the list view here just gives me a list of the appointments for that day. I can see every patient that is here, their time of their appointment, who they are seeing. This bar does change colors based upon the different statuses that they are, if they're not here, if they're checked in, those kind of things. So they're there as well. You have your patient, which is a hyperlink. If you click on this hyperlink, it will take you right into the patient's chart. You have the details about the appointment, and you have reason for visit, chief complaint, if there is one, all there. If there are comments, the comments will show. Now this one here, since it is older, it says that the patient is checked out, but this is where you can see your different statuses, whether the patient is checked in. For you guys, because you don't bring the patients back and stuff, but it would say whether they're checked in, checked out. They no-showed every night at 9 o'clock. If a patient is not canceled off the schedule and they were not checked in, then it will automatically no-show the patient. So that is one thing that is very important, is we need to make sure that that stuff is correct. Your nursing schedules will be on here. I know that is something that you guys aren't used to doing right now, but any nursing injections, anything that you do, the patient has to be on the schedule. because you have to have an order to do your injection. Even though we're not billing for it, the documentation has to be there. They have to be on the schedule because an encounter has to be created, and for tracking purposes that it's in the system. So you do have your nursing schedule, and you can pull it up, and that one is just behavior. Oh my goodness, I can't type. Behavior, there's the Du Bois at Brookville Nurse, and Bright Horizons would be Bright Horizons Nurse. You can pull those up to look at those as well. I'll show you how to add appointments to the schedule and everything so that they can be there as well. But this is where you can't add appointments from here. This is just a visual. Every appointment that is added to the system is added through RevCycle. And I'll show you that. But this is, then once the patient is scheduled, you would just click on their name and it would open into their chart, and then you would be able to do your documentation, and I'll go over that with you as well. Up here you have Message Center, which is basically this here. When you click on Message Center, it pulls this up, but it gives you, like, it will show you your documents over here. So like how you have your summary in GE, and if you click on Chart Documents, it shows you the message and then the list and then the message below it. This is kind of the same thing here. You can also start a phone note or a message from here. It doesn't look like this is turned on. I have to be in a patient's, no, I don't have to be in a patient's chart for messaging. I'll have to check that because that should be available.
I just tried it the other day.
I should be able to click on that, and I can go into a provider's one and show you as well. And then you have schedule, which is just, this is a different view that you can look and see patients for schedules here as well, but you'll stick to home most of the time. You have different patient lists. I mean, these patient lists, I don't feel that you guys will be using these much, but it gives you a list of your patients that are within your practice. So length of stay, this one here, it looks like it is built from maybe inpatient? I'm wondering, I'm not sure, because it says 43 days length of stay, admission date. But this here, this patient list is what the providers will use to go back between inpatient and outpatient. They'll have different lists. So, but you guys won't really use this that much. It just is a list of your patients, basically, that's within your practice. These ones up here, this the staff assignments, the safety attendance, therapeutic notes, those aren't things that you will use. The therapeutic notes are group notes for the therapist. You have your Department of Health PDMP that if you needed to get onto the website and you can log in for the provider to check the PDMP, that is what this is here for. If you have the ability to do that, to check the PDMP for them. And then down here, you have different types of sticky notes, and these sticky notes are will be only when you're in a patient's chart that you can see those. And that's to add like a note to the chart that's not actually the chart. Do we really use these? No, they don't want you to, because they can get really cluttered if everybody would use them, but they're there if you need to. Charge entry. I don't know, you guys don't enter any type of charges or anything, so you won't be using those. There is a calculator up here if you need to use a calculator. If you click on it, it's like a dosing calculator, basically, but it's there if you would need it. Identify formulary, different things, but there's a dosing calculator. Ad hoc is forms. So if if a provider ever said to you and said, I would like you to do it over the phone, just saying, I'm not saying it's a scenario, I'd like you to do a GAD-7 on the patient over the phone. You can go ahead and pull up the GAD-7 from the ad hoc forms. You need to do it from the patient's chart, but it's pull in different types of forms for different types of documentation. You can pull in vital signs. You can pull in their power forms is basically what they're called inside the ad hoc, okay? Med administration is going to be where you're going to document injections, where the meds that you are given, that is where you will document that. You will not have to enter in meds or anything like that. You guys didn't do that before because you didn't get them from the pharmacy. Yeah. So there's that. And then you have different types of conversations, which you guys really won't be using those because the conversations are for rev cycle, and it's different types of for registering the patients and stuff like that. The patients will all check in and see them at the front desk. You also, it's grayed out now, but you have patient education here as well, okay? One big thing I do want to say is you have this refresh button here. It is very important that anytime you make changes to a patient's chart and you come out and you're like, oh, I'm not seeing that change, you want to refresh it. Because if you don't refresh it, you're not going to see that change. And literally it keeps it count. And I don't know how many times I've been on the phone with somebody and be like, well, I just added it. Why isn't it there? I didn't refresh. And as soon as I refresh it, it populates in. So that is a big adjustment that we have to make, is making sure that we're hitting that refresh button anytime that we make a change to the chart. Okay. I'm going to go back to home, and I am going to, here is where you can search for the patient. You can search and put their last name, comma, first name in this search bar, or if you hit the magnifying glass here, you can go ahead and open it up, and it'll give you the search box, okay? One big thing is that when you're doing something with Cerner that is different than what we do, is there are encounters. So when I am saying encounter, it is their billing encounter for that visit. So say a patient was here 2 days ago and I forgot to document their injection and I have to search for them. I can search for them this way and type in their name. I'm just gonna put A and hit search here, and when I search them, the list of encounters are down here in the bottom, okay? I want to make sure that I am choosing the correct one with the correct date of service. So this is the date over here for when I'm doing my document. It's not going in, starting the document, changing the date. It's not that simple, because if you add it to the wrong billing ticket, then it will cause issues. So that is one thing that we have to make sure we're changing it. One of the other easiest ways to do it is when these patients are checked in here, and if I go back to that date, that encounter is attached to this patient based upon that schedule. So if I click on them from here, it will go ahead and open that and open it with that encounter. We do want to try, I know that sometimes it is difficult, but we want to try and get the documentation done before the end of that day. But if it can't be in or you forget, then you can come back. So this here to me is the easiest, but if you have to search, just make sure that you're choosing the right encounter or right date of service associated. Okay. So we will go ahead and it's going to give me some pop-up messages here and there, but we'll just ignore them for testing purposes. So now I am inside, I clicked on the patient's name, and I am inside of a patient's chart. When I get in here, I'm going to be able to see their name, their allergies, their sex. If any of this information is here, their blood type and that kind of stuff, it will display. Date of birth, age, disease alert, their MRN, this FIN number. And when I say encounter or FIN number, they are the same exact thing. So somebody else from over on inpatient side or somebody ever asks you or billing, well, what's the FIN number? The FIN number and the encounter are the same exact thing, okay? So you'll have their FIN number here and the location and who their attending physician and PCP is. You'll have all of that there. Down here, this here, you're still going to have all of the same things that you had out when you were out on your home screen. You're going to have all of these different things in here too as well. You also, your sticky notes will be there. So if I click on sticky notes, I can go ahead and write a note on the patient's chart if I need to. And that's the sticky note. And then the ad hoc forms, if I click on ad hoc, now that I'm in a patient's chart, here are the all different types of forms that are in here for anybody to use. You have adult BH assessment ones and child ones that are specific to you guys or behavioral health, but any of these forms can be used at any time for anything that you would need. There's the suicide risk one, the CSSRS, those are in there as well. There's the GAD-7s, all different kinds of things. So that's what those are. I guess I can show you one, but I don't know or think that you guys do a lot of that kind of stuff, correct, in behavioral health? But I'll show you how they work. So if I click on one, let's just do, let's see what comes up. So I would go through this one. This is suicidal here. I just come through here and answer these questions, yes, no. If it's a yes, it will open this box and let me free type in it. And I just keep going down through and answer all of these questions. When I had said save documents out in the message center, if I click this, that's going to save that document. It's going to go sit in that saved document. The green check mark here is to sign document. So that's, you would sign it, and then it would become part of the patient's record. When you're in here, you have the exit button too. I did forget to go over that one. When you're logging out of Cerner every night, they do tell you that you should exit and not use the X. It doesn't close it down properly. You have your exit here. You also have your exit here. All of these things across the top are the same things that are in your toolbars as well. This here is called the table of contents. So when you do open up into a patient's chart, you will be into what is called the ambulatory nurse's view. That gives you your different types of M pages, your ambulatory workflow, the BH treatment plan, and then just demographics. Then you have this here. You guys won't use that. The results review, this would be where you would have the results of different tests and blood work and things like that for a patient. You would click on the different tabs to see different results. To change anything, if I need to change the date range, I can just click. Okay. I can just click here on the gray bar, and I can change my search criteria and change the dates within the date frames that I need to. And then I would just click OK, and it would change for me. I have orders. You can set up orders for providers, but you have to send them pending for signature. You cannot sign an order. You can't do that kind of stuff. You can set it up for them, but you can't do it. And I'll go over those. I'm just going to go down through this. You have your med list. So there are different types of meds that you have. If I need to add a med from here, this is actually going to add it to like inpatient kind of med list. We want to add our meds from the document, which is weird, but the document medication by history, because then we'll add them in here because it's like they consider that a home med. And then I would add it in through here. I click add and add my medication, and I would search for it and choose my dose. And it's weird, but nothing else happens. And then I just click done, and now it will show up on the patient's home medication list. Okay, pending home med. When I'm done, I can just go ahead. If anything needed filled out still on this medication, because I didn't pick one that had a pre-built verbiage in there or your instructions, I could just come down here, change this to what I needed to by clicking oral and 30, and then I hit document history. And I'll go over those a little bit more in detail because it is easier to do it from the ambulatory page before here. You have your documentation. So any type of documentation that is done on a patient, they are going to go ahead and here. Their treatment plans, their office notes, anything, they'll be in here. Outside records, if there were any outside records, I'm guessing that were scanned into the system, pulled in, this is where they would be. You have your allergies. You can add allergies to the patient's chart from here. You have your diagnoses and problems. You can see a list of diagnoses and problems, and yes, they are shared, but across the system, but they have to be added for billing purposes. You have notes, different types of notes that you can go into, kind of the same thing. And then forms browser. So this forms browser here is nice because it will always give me a quick review of when something is due or a power form that I filled out. So providers' treatment plans, things like that. If that 120 days is coming, they can come in here and look and see when was that last treatment plan done very quickly and determine. Anytime I do a power form, it will record it in here showing that it was done. So here was that suicide risk one. If I double click on it, it will open up that documentation for me as well, and I can go ahead and visually see what I did. Sometimes when you're doing power forms, it doesn't always create a document inside the chart. It just depends upon if that power form is linked to what we call a doc or not. So sometimes it's always easiest to come in here and look at forms to see if it was done compared to documentation if you know it was a power form that was to be completed. References, it's not something, it's just like drug references, education, things like that. It's just a reference area where you can look at. You got your growth chart. You have your family or your history, so you're going to have family, past medical procedures, and social. This here is where any you'll document their alcohol, tobacco use, those kinds of things. It will be all right in here. But it is also, this stuff is all on your M page as well. So it's not, it's easier, I think, to do it from there. You have their immunization history. Nothing's going to pull because there's nothing there. Oh. And you can see the list, although somebody did add one, their immunizations and future immunization schedules and stuff right there. You have a flow sheet, which I don't think we have a flow sheet set up for you guys, but there will be different ones in here for different things when it comes to quality. They are currently working on those. Patient schedule. No-shows, you can see their no-shows. There's nothing in here though, but they would display person with orders, no reschedules, those things. This here is that GEM page that we were talking about, that it should display current problems, med allergies, so it is in here visually for you to see it too. This stuff is in here, and you can show the last 5 therapy notes, no office notes, so it is in there. So providers can come in here and look at different things and last notes from GE as well. So it does look like those are in there. A chart search, that's an error. I don't know what that is, I'm not gonna lie to you. There is a specific one in here that it's the behavior health history that this is inpatient, where they would document their histories. So it's not anything per se for us. And then you have your Verge, if you would need to enter anything in for Verge. Okay. I'm going to go back up here to the ambulatory nurse view. And in here, you're going to see that this is like different duties of things that you guys will have. You'll have, this is like another list of table of contents, but this is the table of contents for this specific M page, this ambulatory workflow you have, and these are things that can become part of a provider's note. You guys aren't going to use these though. There are going to be a select few things that you will use in here, and you can make this list smaller by doing things that you need to do by clicking here on this hamburger over here and going to components. And I say, I don't want to see chief complaint. You're never going to put in a chief complaint, so you can uncheck it so it doesn't display here. They can always be brought back as well. So if I wanted to bring it back, I just click it again, like they're there. It's just removing and only having what you want. You don't need a growth chart. You don't need care team, chief complaint, clinical, diagnostic. You might want diagnostic, but documents you could see. Goals and interventions, that's not something they're using. History, so medications, new order entry, opioid review, order profile, pathologies. So most of these, I mean, you probably can go ahead and remove. You don't have quick visit. Vital signs, you guys don't do vital signs. So then when I am done, I just click out of it, and then it refreshes this. You can also change the order and how you have these. So I want allergies first. Then I want my history. I can just drag and drop these into the order that I want. These will save for you as you make changes, and they're based upon your preferences. So not everybody has to be the same. Everybody can set theirs up how they want. I do recommend, is it in this one too? No. Okay. So they stay. In RevCycle, you have to save them, but here you don't. So then I can go ahead and, did I remove my medication? I did. No, I didn't. Oh, it's there. So home medications, histories, problem list, I want that one up at the top. Oh, my froze.
Yeah, because you're covered on that.
It won't let me off. There. So I bring my problem list up here. So if I click on allergies, it will take me to allergies, or I can scroll here as well. Okay. Allergies, I can go ahead and come in here, and this is why I say it's easier when you guys are doing preloads and stuff like that. Sometimes allergies are important so that they don't. So you would add an allergy. So if I needed to add strawberry, I'm allergic to strawberry. I can go ahead and I can click, type it in, find it. I can go ahead and find a medication. Let's do PN, penicillin. Oh, goodness. There's penicillins. I can go ahead and click on it. And when I do that, what it does is it pulls in, and I can put and document the different types. Is it, how severe is it? You always do have to choose a category, and the category is just food, drug, or environment. And it will pull it based upon how it is set up in the system. Sometimes, though, they don't pull. You always just want to verify that it's correct. What kind of reaction did they have? Is it active? Reaction type, allergy, side effects. So if it is a medication that there was just an intolerance to because they didn't, or they had some side effects, you can go ahead and document it appropriately, because that's not an intolerance or a side effect is not a true allergy, but it will at least pick up when it does different things with medication that it was not tolerated before by the patient. And if you know when it started, you can, in any comments. Then when you're done with that one, you just go ahead and click Save. And I go ahead and click Close. Now that medication is added. When I am completely done adding them, I need to go ahead and hit complete reconciliation. Then that makes it a permanent part and says that I reconciled or reviewed those allergies to make sure that they were correct. Does anybody have any questions on that? If I do it from over here and I come in here and choose allergies, I can just hit add allergies here and it kind of pulls up the same. It's a little bit more complex. It's not as easy to look at. But if I come in here and I type in my substance, or I can change this to side effects, things like that, it's the type severity, and I can come in here and I can type in strawberries again, hit the binoculars, and search by name, and it pulls in, and then I can go ahead and just double click on it. No allergy checking is available, that's fine. And then when I'm done, I can click OK, or OK and add a new, so that will allow me to add multiple and keep going. It's up to you. You can use it either way. I just think that it's easier personally from that M page to add things. I don't think it's as cluttered, but then I would just, I have to enter in my category. So it would be food. And now I can see that that is on there. I'll mark all as reviewed again, and it says that they were reviewed. And then they're a part of the chart. I do have to take a drink. It's really dry. All right. So then the next one here that is on the list is referrals. Referrals are any type of referral that is made within the system. I will say there are some documentation pieces like referrals and stuff that are locked down that providers, like if your provider did a referral somewhere else, nobody else in the system would be able to see it. Nobody else in the system is going to be able to see your provider's documentation. Also, if you're not an IRC nurse, you will not be able to see documentation between behavioral health and IRC. The only people that can see different things is the front staff because they work both. Nurses don't share. Providers don't share. So it is all locked. You will still be able to see their meds and problems, but you won't actually physically be able to see documentation or even appointments when they're scheduled. Though there is lockdown to appointments as well. So this here is kind of just a visual, just to see different types of referrals or things that are out there for the patient. Then you have what is considered to be home medication. Home medications is medication that the patient is currently taking at home or that documented history. You can't add a medication. The system doesn't allow you to really add a medication to the system until allergies are added. It will give you a thing to say that you need, it'll pop up and tell you you need to add allergies because it does that interaction checker. So that is one thing, is try and add your allergies and then add your meds so that they're both in there when you're doing your when you're doing it. There are different things here that you can choose on. These hyperlinks here, any one of these that are blue are also take you over here to this medication. So if I click on this, it will launch me over here. In here, over here, you have to add medications. It looks like that you don't have the simple search to do it. You have to click on home medications to take you over here to launch it, to hit this documented medication by history. So you will want to click this, like I said earlier. You're going to want to go ahead and click add medications. You also have unknown home medications. So if you don't have a list or whatever from the patient, there is also a way that you can go ahead and you can go and click. There's an area, I don't know if you guys have access to it, I'll have to find out. But once with the e-prescribing gets connected, so a patient didn't bring a list of their meds, there is a button that does go out to the pharmacies and it will pull back and show you a list of the medications that the patient most recently had filled. You can add them to the chart that way as well. So that is something that you should be able to do to help do that. So you would just click add medication. Don't mind that. You should not get that because my patient's old from a date. You're going to search for the medication. So I don't know what medication you want me to add. Abilify? Oh, I spelled it wrong. There it is. So I can go ahead and here's these ones here that have the one tap. These are what we consider order sentences. They're pre-built out medications. If you choose one that doesn't, you'll have to fill in all of the instructions and the dosing instructions. But you can choose one. So if I did this one, we're going to do the 5 milligrams so I can show you. But when if I click on 5 milligram tablet, this is what it's going to look like. And then I can go ahead and I can add another one if I want to as well. And it will list them, and then I can go and do the instructions. So let's do Xanax. I can go ahead and I'll add this one with the prescription stuff or the instructions. Then once I'm done adding them, I can go ahead and click done. And here are the list of my pending medications. Now what I can do is I can go and highlight each one of these and update my dosing instructions. So here is my Abilify 5 milligrams. It did pull in some instructions. So it's 1 tablet by mouth daily. If I need to change this, I can go ahead and click the green dot and change it to 2 tablets, 3 tablets. They are pre-built instructions. So if there is something that isn't in here that you need put in here, you can let us know. What is the route and what is the frequency? You can hit show all and choose what is needed. This list is huge because it is inpatient stuff as well. That is the only bad thing about sharing a system. You can also you can start free typing in here. So if I just need BID, it will pull it in. They do use QD, not QD, which we weren't allowed, but they use it in inpatient. So QID. So we'll pull those in. You can go ahead and if you needed it to become a prescription. Oh my goodness. The duration, 30 days, 7 days. If this is going to be just a medication that is standing and it's not going to expire, you don't want to put this in here. You would like to leave it blank. Dispense, if you're not turning it into a prescription, you wouldn't put that in here, or refills. Then once you're done, you would just go ahead and make sure that all of these are filled in, everything you need. If I didn't need this one, I would click none and it can delete it out as well. So I can come in here and change things as I need. And then when I am done, I hit this document history and it pulls this in. And then I can come back out here and go to my ambulatory page where you see none of those medications or even those allergies that I added are here. Because what didn't I do? Yep, I didn't refresh. So last time I refreshed was 24 minutes ago. Those will pull in now. My penicillin, my strawberries, and here are my home medications. They are there. Okay. You can, if I need to modify a medication or you need to do a prescription or if they completed it, once these medications are in here, you can manage different things from here. I can click on this Tylenol and I want to cancel or discharge it or discontinue, not discharge. Click it and then that will remove the medication from the patient's list. If I hit refresh, it crosses it out. If I need to do something with the Xanax and I need to renew it, I can go ahead and renew it. Do not send call to pharmacy, do not send samples given, do not send, there's different reasons. E-prescribing eventually will show up here, but e-prescribing is not set up in mock. From my understanding, is that what you, or it's not set up completely yet? Because they're still working on different things. Then once you get down here, the problem list. So then the next thing on there is the problem list. This is just their diagnoses that they have. The problems do have to be added to the patient's chart, or the providers won't be able to do their billing. They won't be able to prescribe. They won't be able to do different things, and they will start yelling at them. So anytime that they order, they have to associate diagnoses with orders, because that's something that's new. There is no more paper orders once we go on CERN. Our paper orders are gone. Every order will be put into the system. If the patient needs to go somewhere else to get it done, we just print off a requisite and give it to them to get it done. But in here, this here is your problem list. You can go ahead and search here for a problem. You can do classification, you can change them. This visit, classification, medical or patient stated, you can change that. Most of the time we just leave it as all. You have your add as. Do you want to add it as to for this specific visit? Is it a for this specific visit and a chronic problem, or is it just chronic? When you're preloading, it will just be chronic because you're not associating it to a visit because the patient's not here today. If you don't add it as chronic, it will go for this visit, and then it kind of does fall off and go into this all previous category. So it won't look like an active problem on the patient's list if it's not added as chronic. Okay. So when you're doing different things, depending, you will just click add and you'll search for the problem. So I'll just add hypothyroid. If I choose that, it will go ahead and it will add it here. And see how these check marks are here? That added it as chronic, but if I only had this visit, only this visit check mark would be there. The providers then, when they're doing their documentation, they'll come in here and choose this visit to associate it with this specific visit to associate it to their documentation, because they're not going to address every problem that is on that list. Once you associate it with that visit, you will see here that it numbers them. Oops. I don't know what I just did. It'll associate them, so it must give me a pop-up. No. And then it numbers them, and then they can take and move them in whatever order they want or whatever for this visit. You can also resolve problems from this list. So if it is a problem that shouldn't be on the patient's list anymore, because you know, the UTI and it was from 6 months ago, you can click on resolve and it will go ahead and resolve that problem for the patient, and it will remove. Did I choose? Oh, resolved. I gotta hit refresh. It won't move it down there until I hit refresh. Here we go. I have to uncheck this visit too. So then once I uncheck this visit, it will move it down there. I'm learning new things every day. And then you have all previous visit problems that if there were one, you could add them back to chronic or click them for just this visit. Those are there as well that they should display. Down below this one here, I kept this here as documentation. It is any documentation or notes that the patient had done that you can go ahead and get completed or in progress. You can see notes. If I click on them, it will open and show me the note over here that I can view it and display it. I can print it if need be. I can see my result. Here is new order entry. So this in here, if you want, you could come in and set up orders for your providers to sign off on. In here, you have your meds, RX, and ambulatory and office meds. So this is for prescribing if you need to set up a prescription for your provider to set up. This one here is for in-office medication. So we will go ahead and I will search the one medication that I know is in the system for you guys. And it's just luck because they're still being worked on. So Haldol. So if I needed to do a prescription of Haldol, I can go ahead and come in here, and this is an in-house medication. So I'm hoping this is the right one. It will call me a liar. But if I click on this, it will go ahead and there's no order association to it, no sentence. So that's, I would just click OK. This is what you get when you are setting an order up for your provider. You will choose what provider you want this to go to. So I am going to do it for our AAP because I'll go in and show you what it looks like on their end. The date of the order. There are also going to be ones in here that Sierra set up, and I don't know those lists. But there will be different things in here, and you'll be able to tell if it is like a standing order one for like your Haldols and those different things, those meds that you give. You can set up a standing order that's good for a year, or and there's different things in there that you can go ahead and do that it is this dose. Oh, what is?
I think all of them we put as the standing.
As standing orders.
In Vega, you're talking about.
In Vega, yeah.
Vega was the only one that we did the titration on, but every other one is the standing.
Okay.
For them, for me.
And so they're good for a year. So you would only have to set this order up. And how you can tell the difference between them, and the issue is they're not, I can look up in Vega, but let me go ahead and I'll look up in Vega after this one because you might be able to see the order. Yeah. But the issue is the medication isn't in there from the pharmacy. Even though you guys provide your own meds, the pharmacy still has to add it for you to give it. And they're in the process there. So on the 2nd, you said, right? Or Betsy or somebody said it's taking them to the committee for approval. No, to the committee for approval.
Oh, yeah, no, that's not till next month.
June.
Yeah. But I'm pretty sure Vega's already approved. And Vega, I think, was the only one, I think, but.
Okay.
So maybe
it was set up as an order in the system, but I can't, I can show you the order, but when we go to document it, it won't be there because it's not, the pharmacy hasn't added it on their end.
That's not till June.
That's not till June?
Because,
okay.
We didn't get the paper signed. She didn't get that until the day of the meeting.
Ah, gotcha.
So.
Nope. So, why is this? I need to find this provider. Because I want to go show them in a provider's message center box. You know what I mean?
I always have to go in there because I can never find any of these past ones.
There's going to be 1,000 now and froze.
Yeah, I was thinking that.
So, ooh. BH Ambulatory, that's why I couldn't find it. So, okay. You can go ahead and if it is, you have a written or a fax for an order, you can put it in as that. And then you also have a verbal read back verified for verbal orders. MAs won't have that listed there. LPNs will, but that it still will require the provider to have a signature. Electronic or protocol standing order. So those ones that are different things, you can go ahead and choose that. This is like just a different type of communication. And then up here, you see how you have an order or a proposal. If it is a verbal order and the documentation is in there that you took the verbal order and you read it back and you did things appropriately, you can use that and order it. But most of the time, you're just going to be coming in here and you're going to be setting them up and you're going to be sending them as a proposal for the provider to sign off on. And you'll just hit communication type electronic and click OK. And that's going to go ahead and send that medication to the provider's box to sign off on. Okay. Let's see if INVEGA is in here. INVEGA. Yep. So see how there's this little box here? Those are the ones that are like your standing orders. They are called power something. I don't remember what they're called, but we call them power. But this here, the instructions for it is that this one is 117 milligrams per 0.75 ml maintenance every 4 weeks. There are stars here. So if you see, anytime you see a star beside something, you can click that star and it will save it to your favorites. So that is the one nice thing about Cerner, and it's your favorites. It's not everybody else's favorites where you add them. That is your favorite. So if it's something that you look for or search for frequently, you can go ahead and add it to your favorites, and then it will go to your favorites list. And if you click on mine here, it pulled in my favorites. I didn't refresh, so that's why it's not there. Let's see if I refresh. Does it pull into my favorites? Good. It's supposed to pull into mine. There is a public one too, or share. Oh, I was on this one. It's still empty. Maybe because I didn't add it completely. I'll have to look at that and make sure I can add favorites. But that's how you can do that. And sometimes too, like it's really goofy because these say ambulatory meds RX and in-office meds. If I click on here, I can also search for labs. It's not just medication. So if we needed blood work and I needed a CBC, I can pull up the CBCs and add a lab order for the patient to get done and propose it for the provider to sign off on. I don't know if there's ever phone messages where he's like, we need to check their lithium level or we need to check this. You can go ahead and set up that order for them to sign off on if they don't give you the order for it to be done when they're doing the message. So you have that there. You can also do it from orders here. So if I click it and I hit, new order entry. This computer has a mind of its own. If I click on new order entry, it will take me over here to orders, which is the same case scenario. And I can come in here and go to medication list, add medications. I can go ahead and click on plus order, and it will go ahead and allow me to order different blood tests, things like that. And I can go ahead and add those. So if I type CBC, it will pull those up. I can go ahead and do a CBC. The goofy thing is this threw me for a loop. I was like, it did nothing. I was like, I added that, but it's again, I can go ahead and add multiple tests. So if I needed to add a lipid next, my lipid panel, I can go ahead and I can continue to add. Once I am done, I can click done, and it takes me back out here to this page, and this here will show me that these I still need to, the X stands for it's not complete, that there's something missing from that order. So the order details are complete. So I can click on this one, this lipid panel, and then down here below, everything, that X will also tell me what's missing. So it tells me that I'm missing my diagnosis. If I was missing details and things like that, then it would display here. And you can come in here and you can change these orders. The details are, you know, if you don't want that order to be for today, an order for labs is good for a year. But if you didn't want it today, you wanted it in 6 months from now, you can change that date. So then the patient can't get that until around 6 months from now. The collected by, you guys wouldn't worry about that. And future orders, it should always be a yes, unless you're collecting it in the office that day, but they still set it up as a future order, and then the lab would activate it. And then order comments, any orders or comments or anything that would be specific to this order. And then your diagnosis is whatever diagnosis was associated with that test, you would just choose it and click and then move to your next one. You don't want to hit sign until you have them all done. And then you would come here and choose the next one because that was the only thing missing. That doesn't like my code. Okay. And then when I was done, I can click sign, and it's processing those. Allowed the nurse to sign those orders.
It might come up with that thing we decided. It was going somewhere to talk to me the other day.
Okay.
They could let me sign it, but that's still.
Let's see what it is.
I was like, how does it know where it's going?
Down there, the status. Documented. Oh wait, that's meant orders. Future order. No, I don't know.
I just sign it.
They didn't let them sign it. Future status on hold. Okay. Ooh. Yeah, write that down. Thanks, Blair. So, I mean, that is orders. I am going, because, I mean, does anybody have any questions on that? Because those are going to be your guys' main things, is like with the preloading and adding problems, meds, allergies, those kind of things. Other than that, and phone messages. Am I missing anything else that you guys do? Please help me.
Now, if they're already in STERM, or like they were seeing a patient, or, you know, that already.
Yep. Does somebody on the phone have a question?
Nope, we're good. I'm good.
You're good? Sierra?
Yep. Nothing here until I get in there and kind of mess around with it, and I'll probably get some questions.
Yep, nope, and that's perfectly fine. So then I am going to go ahead and show you the med administration. I need to log in as the provider and sign that order. So in 1 second.
And when the doctors are putting in a control, is that PDNP automatically going to be, they can just check and it will.
Yep.
For the doctors.
So there is a section on the provider's M page that says PDMP, and they can click a button and pull it back, and then there's a checkbox at the bottom that says verified. And when they check that box, it records it to the chart, and they're good to go.
Okay, yeah, that's what's happening for them now. No, we still have to get the PDNP each time.
Yep, but with the providers, like if before they're prescribing it, like they should just do it, and you shouldn't have to get into the PDMP.
Right.
You should just be able to set it up.
Early
or something. Yep. Nope. You would still, because that goes by your NPI.
Okay.
So that's why the nurses don't have the ability to do that. It would be nice. I didn't hit mute, did I? Nope. Power chart. Just remember, I have different logins on here. This better be in here. Do you see it?
Schedule.
Orders to approve. Did I not completely put it in?
We're just doing ours on,
Okay.
same on.
Okay. Let's see if it's here. Because maybe I found it. That's where things I think are goofy.
Oh, okay.
You get a pop-up. Okay. So I'm gonna like order medication. We're gonna see if I added that because that order is not there. So let's see here. So if I come up here to my med administration, you're gonna get this, and this is where the tediousness comes in. But please scan patient's wristbands. We don't have scanners. We don't have wristbands. So you are just going to automatically hit next. You're gonna get this why. You're just gonna choose the reason as unable to scan, or no scanner available, whatever one. Then you're gonna hit yes. Nope, I have no orders. This is what it did. And if there is no orders, because there was nothing will show up and you can't move on. So that's why I say you have to make sure you have your order before you can administer. Let me just log in here as the APP. Oh, maybe because I wasn't in. Yeah, no. Okay. Let's go to XX mock. What was that patient?
That sometimes one.
And who knows? Maybe I didn't send it to the right box. I don't. Those are. Oh, no, I know I work testing. Oh, I gotta do this first. I'm just putting a number in here, guys. I know it may not be correct, but.
So the provider's gonna have to do that part, right?
Yeah. Or the nurse can set this part up too, and they would hold it to them for a proposal. And they should be, a lot of them should be built out as order sentences, and if not, we can make them. But since I'm have to grab a generic med just to show you how this works, since nothing's built in here yet, I have to fill it. Routine intro. Frequency, do 10 days. Nope. Every nine times a day? No. As indicated, we'll just do it as that. So now I'm gonna go ahead, what didn't I do? PRN reason, cough, I don't know. Times. Okay. So there. So there's my how doll. I can see that this medication is ready for me to be given. I just click the X mark beside it. If there was something I could click here on the yellow, there would be yellow sometimes here too. But if I hit the check mark, I'm gonna get that pop-up again about the scanners. This is where it kind of becomes a nuisance, but then I would go ahead and just choose no scanner available again, click yes. Has not been verified, that's fine. And now I can see here's that yellow that I was talking about. If I click on it, it is going to open up, and I come in here and I fill in my instructions on how it was given. The 12 milligrams, intermuscular, if I need who did it, your name should automatically pull in there. If it was witnessed by somebody, if there needs to be two of you on administration, you can put it there. What is the reason for it? Why? If it was not given or it was refused, then you can go ahead and choose that too. And then once it is all done and you choose your site, you would just click OK. And when you're done, you click sign. And then that went and did that order in administration.
So we can see all of the ones that were given.
It goes in, should be in your, honestly don't know. Nope. No, it goes into the MAR, sorry. So all medications that were administered go into the MAR. So you can go ahead and see the last time they were given and everything over here. And it will create a list of them. But they live in the MARs. Am I teaching you something new? Or taking notes?
Yeah.
And then you have like a MAR summary too that you can, it's just a summary of what the MAR is. But this is where that would be. All of that stuff as you see those in the MAR.
So if I give that shot today, especially every 4 weeks, will that just automatically populate it in the schedule in 4 weeks? You said
The order?
Schedules, right, yeah.
Yeah, you'll have to put the patient on the schedule.
If they noticed it that day, because there's probably a handful that's not reliable to come.
So if they don't come on the days that they are scheduled, there is different queues and things, and I will go ahead and go into the scheduling piece. I have you guys for a little bit longer, right? Okay. There are things out there for the scheduling. I'll go into it here real quick, just real quick. But you have Rev Cycle up here. So you will click on Rev Cycle, or you'll have your app bar that you can log in with your app bar, and it will automatically log you in. but mine is, I'm not. So I'll just continue as the AP here, because it's the same. I think, oh, how about not? We'll do BH office. I don't,
Scheduling.
they should have it, but I don't know. Getting this right security system.
So
Mhm.
in the MAR, is that third?
It doesn't pop in the MAR until it's administered.
Okay, perfect.
So the MAR just keeps track of the administrations of the medication. The order, if it is a standing order, it'll stay out there until it expires.
Right.
Or it is discontinued. Yep. So in here, this is rev cycle. Rev cycle, you have your different views here. Everybody will be on the resource view kind of, and it's just a list of the schedules, and you can set how you want to see these schedules. There's different settings and stuff, and we'll work with everybody to get these up. But when you want to schedule a patient, the easiest way is you're going to search for your patient, or if you're in here and you're on your patient tracking, and this is the same thing that you see in your chart. So they will come in here and they will, you can see them. If I need to schedule this patient for a visit, I can click on them here and I can come in here and schedule the appointment. I will search, come on, load. How you have to do them is you have to search for resource. Your resource would be behavior, would be your nurse. Behavior, you would hit search, nurse, Brookfield nurse, whoever. Your appointment types, you only have one appointment type, that is BH nurse. And then the location should be next. So it pulls in the location, so they're all associated. You hit next. And you can go ahead, hit their insurance profile. They should always have one in here that says professional. You will choose professional. Any comments, the comments do show up on your schedule, or when you're looking at those views, this is where you would put it. So if you want to put what type of an injection it is for, if it is, that they're going up on their doses, you can put reason for a visit. It is red, so if there's anything red, it does have to be filled out. And then you can click first available, and it will pull up the first available appointments that you have. Or you can just hit schedule. I figured most of the time you guys are going to hit schedule because that's what you're used to. And then you go to the schedule, find the day that you want, click on the time slot that you want. Look here, make sure that the appointment looks correct. You tell them to make sure that, just instructions, make sure you bring your photo ID, insurance cards, and come 15 minutes earlier. And then when you're done, you're going to go ahead and hit confirm. And this is, you have to add a counter. So it is very minimal in what you have to do, but you have to do with pre-registration for that. So, so in here you could say complete prefeg, no, because you're going to, unless you have the information with the patient there, you can verify it all, but that's only a couple days. But it's good to know medical services, it's going to be behavior health, and anything else that is red, any asterisks. Most of the time they are all filled in. Normally I fill in those two things and I hit save. And if it doesn't tell me how something filled out, then it will go. But this one's telling me I'm missing something. So if I click OK, it will take me to it. That's the one they sing. Oh, my attending physician. Who is it for? Was that BH? I don't know, we'll put Rika. He's my favorite there. So then when I'm done, in their primary care, and then when I'm done, I hit save, and then it will go. But if there is a red asterisk not filled out, it will stop you and make you fill it in. And now I should be able to see. Because I scheduled it for the 20, I scheduled that. Why isn't that showing there? Oh, yeah, because it's for today and not a future appointment. That's why. So those there are also, like, here is a work queue list. So if a patient no-shows and you don't cancel them and they get automatically canceled at night, or you go in and no-show them, there are these different types of work queues here that you can go. So it's actually called, is it the request list? And then you will search for your request list. So request by queues, and then request list. Your request lists are, they're all behavior, Dub, Brook, or Bright Horizons, but you have your needs rescheduled, needs scheduled, and a wait list. And in these work lists, you will go ahead and you will click on them and work them. So if it needs rescheduled, even if, say, a provider comes and tells you and says, I need today off, I need you to reschedule my patient, you can go in and cancel everybody off of that thing. What's going to happen is they're going to go work queue. And say that they need to be rescheduled. So then when you do that, you have to go ahead and
Did they get
no, patients, patient portal.
like on, did they get okay.
So then once I do that, it will be fine. And if there are in here, here's messages that are patients that will need to be rescheduled. And from here, I can go ahead and I can right-click on this person. I can complete my request, which means it will take me out to schedule the appointment for their patient for their appointment. I can cancel this and say, nope, we're not redoing this. I want them off my work list. Modify the request, and record a contact. Record a contact is basically just that you tried to contact the patient, that you want to record how you did that and who or how you did it. So you can come in here and put those in here. I don't know how. These are supposed to open up. Let's see if this one works right. There. I don't know why the other one didn't open up. But I can come in here at home phone. Oh, because there was a phone number in there. No, not for that patient. So that they reached, answered, left message on a machine. So if you left a message, you can come in here and type a comment and save it and record. Normally it's after 3 attempts. You can send them or mail them a letter. That's up to you guys and how your policy is. But you can come in here and record those and click save. And that patient will stay on that list until that request is completed. This is something that everybody may have to work at together at rescheduling and scheduling of patients or going down through and seeing what needs done. Does anybody have any questions on that? I know that was quick. And I don't know, are they helping with backload and stuff too of appointments or no? Nope.
What?
Are they helping with backload of appointments?
Yeah, probably.
Probably. Okay.
Backload today.
You did backload today?
Yeah, we got started on it today.
And how did that go? How's it going, I guess?
Well, good. After I got in stuff, it went well. Yeah. I got through a day, and I think you could probably take on a week. When I get a full day to do it. Hopefully, maybe tomorrow I can try to get in a full week of it. It just takes more
How-
time because you have to add the insurance, you know, but.
Yep. That will be, that is the thing, is making sure that that professional in your office is there.
Yeah.
And at some point I will help you guys. That is part of my plan at helping you, but, my son will not let it go. Okay, stop recording, because that's on the recording. Huh? Stop.